In this video, we'll be discussing the concepts behind a very important procedure, blood typing. Oftentimes, patients need a blood transfusion because they've either lost blood due to an accident or normal blood loss during surgery. It's not uncommon for patients to need a blood transfusion because of surgery. And if the blood is not properly matched, the patient may suffer what's known as a transfusion reaction. In an acute transfusion reaction, the donor red blood cells end up completely lysed, just burst into pieces. This can lead to kidney failure, and it can cause something called disseminated intravascular coagulation. Disseminated intravascular coagulation, also known as DIC, is when the clotting factors in your blood become active all over the body. This causes lots and lots of small blood clots that can block blood flow in important organs, and somewhat paradoxically, it can prevent coagulation when you actually need it. So it's like the worst of both worlds. You get all sorts of inappropriate blood clots, and you can't make a blood clot when you really, really need it, because your clotting factors have all been used up. Obviously, acute transfusion reaction is not a good thing. So, the blood of both donor and recipient must be carefully typed before a blood transfusion takes place. Blood typing is necessary because of the molecules on the surface of red blood cells. Red blood cells can have either type A glycoproteins on their surface, or type B glycoproteins on their surface, or they can have both or neither. If they have both, that's blood type AB. If they have neither, that's referred to as type O. These glycoproteins are sometimes called agglutinogens. So, you have type A agglutinogens, type B agglutinogens. If you have both types, your blood type is AB. If you have neither, your blood type is type O. Type O is the absence of A agglutinogens and B agglutinogens. Now, these agglutinogens, these surface antigens on your red blood cells, are problematic because your blood also carries preformed antibodies that recognize all blood types that your own red blood cells don't have. These preformed antibodies are sometimes called agglutinins. Antibodies are proteins that are naturally produced by your immune system, and usually they are only produced once you see an infection, a bacteria or virus, and your immune system will make antibodies against the bacteria or virus. So antibodies attack things that are not normally present in your body. All right? Now, for unknown reasons, you have preformed antibodies. So if you are type A, you have antibodies against type B agglutinogens. If you're type B, if your blood type is type B, you have preformed antibodies against type A agglutinogens. Now think about this. If you're type AB, are you going to have preformed antibodies against A? No, because your blood cells normally have A. Are you going to have preformed antibodies against B? No, because your blood cells normally have B. Right? Now, it's these preformed antibodies that are the problem. If you get blood of the wrong blood type, if you're type A, for example, and you get type B blood, the preformed antibodies, the agglutinins, will recognize and bind up all of the donor blood cells into these clumps that get broken apart. Now, those clumps are very bad if they happen within the body, but they do make it really pretty easy to do blood typing. All you have to do is mix the blood, mix an unknown blood sample with known antibodies and see if you get clumping. Okay? So, Up here, we're looking at two different serum types. This is convention for talking about the antibodies. You have anti-A, so they recognize type A agglutinogens. Anti-B serum contains antibodies that recognize type B agglutinogens. So, if you have blood that's type AB, it has both A agglutinogens and B agglutinogens. So you get a positive clumping response for A and B. So it's type AB. If you have type A blood, you get a positive response, the clumping with the anti-A serum, and a negative response, no clumping with the anti-B serum. So they have A agglutinogens only. If you have type B blood, you get a negative response with the anti-A serum, a positive response with the anti-B serum, and you know you have type B blood. If you have type O, remember type O is the absence of agglutinogens. Don't think of it as type O, think of it as 0. So with no agglutinogens, you get a negative reaction with the anti-A serum and a negative reaction with the anti-B serum. Type O blood. Now, this clumping reaction only happens if you have surface antigen plus the right agglutinin plus the antibody that recognizes that surface antigen. Okay, so if if the donor is type A, it's only going to happen if the recipient has anti-A antibodies. All right? If the donor is type B, it's only going to happen if the recipient has anti-B antibodies. All right? You have to have both surface antigen and the antibody in order to get this nasty little transfusion reaction. Nasty big transfusion reaction. So, someone whose blood has no antigens can be the universal donor, because it doesn't matter what antibodies the recipient has. The recipient could have anti-B and anti-A antibodies, but it doesn't matter because there's nothing for those antibodies to attack. Someone who is type AB, they have both A surface antigens and B surface antigens on their red blood cells. Well, they're not going to make any antibodies. So it doesn't matter what the type of the donor is. It doesn't matter what the donor has as far as surface antigens, because there's nothing in the recipient to attack those donor red blood cells. So type AB is the universal recipient. Just for kicks, this table shows ethnic differences in blood group distribution. On average, type O is actually the most common blood type in the US, although type A is pretty close. B and AB are rare. And there are some differences between ethnic groups. So even though O is the universal donor, and even though if you are type O and you get in the blood and the blood bank learns about you, you'll get tons and tons of calls from them, it is nice to know that the universal donor is rather common. There's one other element considered in blood typing. If you know your blood type, you might know that you are, for example, A positive. What this positive means is that you have type A surface antigen on your red blood cells, and that positive means that you are positive for something called Rh factor. You're seeing that being positive for Rh factor is actually quite common in the US population as well. So with Rh factor, it's either a positive or a negative. You either have it or you don't. If you have it, it's fine, no problem, doesn't matter. If you are negative, if you're Rh negative, and you're a woman who plans to have children someday, then you need to know that you are Rh negative, because if you're Rh negative, you can become sensitized to Rh positive blood. It's not like the ABO blood types. You don't have preformed antibodies, but if you're exposed to Rh positive blood, you will make antibodies against Rh factor, and then those antibodies will attack any Rh positive blood they come into contact with. This becomes a problem if you are an Rh negative mother trying to carry an Rh positive baby, because there is some communication of blood between mother and fetus. So, if you're an Rh negative mother and you have an Rh positive child, your first pregnancy is likely to be okay, but towards the end of pregnancy and during delivery, you're going to become exposed to some of that baby's blood and you're going to get sensitized to it, right? So if you get pregnant again, you're going to have antibodies in your blood that will attack the blood of your second child, if your second child is also Rh positive, right? And that leads to a condition called erythroblastosis fetalis. Erythroblastosis fetalis is also sometimes called hemolytic disease of the newborn, and what it is it's an anemia caused in the fetus, in the infant, because the mom has antibodies that are destroying that infant's red blood cells. This fetus tries to compensate by sending out immature red blood cells, like the ones you're seeing there. They still have their nucleus, so you can tell they're immature. So it's typical to see these immature red blood cells in the blood of an infant with erythroblastosis fetalis. Since their red blood cells are being destroyed, their blood can't carry sufficient oxygen, and the lack of oxygen can cause brain damage or even death if it's not treated. It can be treated by a blood transfusion. You can actually do a blood transfusion before birth. But nowadays, what's most often done is Rh negative mothers are given a treatment called RhoGAM. And what RhoGAM is, it's in a particular type of antibody that prevents sensitization to the Rh antigen. So the mother's immune system never sees those Rh positive red blood cells and never gets sensitized to it. So now if you're Rh negative and you get pregnant, you're just given RhoGAM. They don't even bother to type your husband or type the baby. If you're Rh negative, they give you RhoGAM. Alright, after watching this video, you should be able to answer a whole bunch of different questions about blood typing. I highly, highly recommend that you go through and you take each of the 4 possible ABO blood types and you figure out, number 1, what surface antigens they have, number 2, what preformed antibodies they have in their blood, and then go through and figure out who each blood type can donate to and who each blood type can receive blood from. All right.